So much for staying with us this morning. 1 in every 12 persons worldwide is living with viral hepatitis. Approximately 240 million persons are infected with chronic HBV, and another 80 million are infected with chronic HCV infection. You'll get better understanding of all of that in no time. So globally, an estimated 70% of primary liver cancer and 54% of liver cirrhosis are caused by viral hepatitis, and approximately 1.4 million deaths from viral hepatitis occur every year. The proportion of persons living with viral hepatitis is greatest in Asia, Sub-Saharan Africa, and Egypt. Nigeria accounts for 8.1% and 1.1% of 205 million Nigerians living with carriers of HBV and HCV respectively. So many other data to give, but let's leave that to our guest this morning, talking about viral hepatitis in Nigeria. Dr. Nsabasi Ekanem is National Coordinator, Civil Society Network on Viral Hepatitis, Nigeria. Thank you for joining us this morning, Dr. Ekanem.
Thank you for having me.
What are we dealing with?
Well, today is a very important day because it's a day that we globally, all across the world, are commemorating the World Hepatitis Day. Hepatitis is a disease of the liver, is an injury to the liver, which leads to conditions like liver cancer. And like you've rightly said, over 70 to 80% of all liver cancer cases as a result of viral hepatitis, particularly hepatitis B and C. Even though the types of virus, the types of them differ. We have hepatitis A, B, C, D, and E, about 5 types. But the major challenge with the world today is hepatitis B and hepatitis C. And just to put the facts out there, in Nigeria alone, we have not less than 20 million people, that's 10% of our population, are infected with hepatitis B or C. That is 10% of Nigeria's population. Now, every 30 seconds, one person dies of viral hepatitis. And so 1.3 million people across the world die every year as a result of viral hepatitis. This is a very, very serious public health threat. And for Nigeria, we can say categorically that Nigeria is an epicenter of viral hepatitis, which is why it is important for us as a country to come together and develop strategies and make financial commitment towards activities that are targeted at eliminating viral hepatitis. That is the reason why we're here, to say enough of the rhetoric, enough of the gainsaying. It is time for action. It is time to put all the boots on ground and make sure that we identify people living with viral hepatitis, get them treated, and get those who don't have the virus to be protected by giving them life-saving birth dose immunization against viral hepatitis. That is the reason why we are here. We want to stop this cankerworm. We want to stop this threat because it is actually killing a lot of, and these people are not, they're not statistics, they're people like you and I. So it means a whole lot for us because if we don't stop it now, it might stop all of us.
Very, very concerning. One of the scary things that you said now is that a good number of people, 20 million you say, that are living with this condition are not even aware. How do we even deal with that in the first place?
Yeah, so like you rightly said, over 90% of people living with it are not aware. It's not even people that are not living with it, but even those who have the virus, over 90% are not even aware of the virus. And that's why sometimes when you engage them after they have been tested positive, and you tell them that, oh, you have hepatitis, they will tell you, is it hypertension? Because they don't even know. That's how bad the situation is. But what can we do? What are the solutions? The solution is to strengthen awareness. And that is what we are doing. In fact, the Civil Society Network on Viral Hepatitis is organizing awareness campaign in all the 36 states plus one in Nigeria within this period of the World Hepatitis Day. We are calling on people to come and get tested so that they can know their status, and from there they can know what to do. If they are infected already, they can proceed for treatment. If they are not infected, they can take vaccine that will give them lifelong immunity against the virus. But for this to be achieved, for awareness to be created, there is need for funding, which is why we are calling on the government. We are calling on international development partners. We are calling on the private sector. We are calling on everyone, philanthropists, everyone to donate, to make financial contributions so that there can be enough pool of funds to support advocacy, awareness, and enlightenment to ensure that people who are living with this virus can be identified and can be linked to treatment so that they will not die as a result of complications from viral hepatitis. That's basically what we need to do right now. By so doing, we'll be able to create that much needed awareness, and everyone would be aware and be able to protect themselves from viral hepatitis. And those who already have the virus will be able to take steps towards getting treatment and getting, the right care so that they don't end up dying as a result of viral hepatitis.
What are some of the obstacles challenging the diagnosing and treatment of hepatitis in Nigeria?
Well, the main obstacle, like I said, is funding. Because, you see, for viral hepatitis...
How about the challenges? How about the major challenge of awareness?
Yes, awareness is a challenge. Okay, so in about 4 years ago, precisely 2019, we conducted an assessment to see how much people are aware about viral hepatitis. And it was so disheartening to note that from the study we carried out, over 92% did not even hear about what we call viral hepatitis. They have not even heard about it according to their responses. Now that means only 8% of people know about hepatitis, a disease that is affecting 1/10 of our population. So it's important that we actually identify these factors that are causing that decline in awareness. And let me put it very clear here. You see, when HIV came into Nigeria some many years ago, the awareness was very poor. People did not know about HIV. But because the world was interested, there were concerned, there were commitments from outside. More funding was brought in and more awareness program, sensitization program, enlightenment program were held. Radio jingles, media adverts, and everything was done towards making people to know about HIV. Today, everyone knows how to protect his or herself from HIV. Unfortunately, hepatitis is an orphan. Nobody is really showing that much interest. And let me tell you why people don't show interest. So you understand the dynamics here. Hepatitis is a chronic condition. And so most times people who die of hepatitis are believed to have died from something else. Let's say, for example, I'm infected with hepatitis B today. It might take me the next 10 to 15 years to actually come down with liver cancer. And within that period, I may have had malaria, I may have had typhoid, I may have had many other conditions. So at the end of the day, if I end up dying as a result of maybe liver cirrhosis or liver cancer, at the first glance, somebody will feel, oh, he died of something else. He may not know that it was the viral hepatitis that I contracted, maybe hepatitis B or C, that I contracted many years ago that is causing the mortality. So that is why people don't really associate mortalities to viral hepatitis. And that's why the commitment and the concerns are lesser. What we are saying is, and in fact, most times it is during autopsy that we probably, when we check and we see that the liver has turned into a hard surface, a hard substance, like maybe like a stone, that tells us, oh, this liver actually had issues. That probably shows that there was cirrhosis or maybe there was liver cancer. So it is even, most times it is from cases of cancer, mortality as a result of cancer, that we now know, okay, it was actually due to hepatitis. So that is why the awareness is low, the commitment is low, the concerns is low. But what we are saying now is, if we can have commitment, first from the government, because let me tell you why I emphasize on the government. The government can bring all other stakeholders into the one room and say, let us actually work towards eliminating hepatitis. And I'll give you an example. The government of Egypt, some years ago, brought all stakeholders together and said, look, let us address the cankerworm of hepatitis C. And I can tell you today that Egypt, that was one of the highest burdened country as far as hepatitis C is concerned, today has eliminated hepatitis. The same with Rwanda. Even Namibia is on the track to eliminating hepatitis. So we need to make sure we bring stakeholders together and put together some significant funding to fund awareness program on the social media, on the digital media, even on print media, and even sensitization, engagement, community engagement. Go out there and tell people that this virus exists, this is how to prevent it, these are the causes, and this is how to get treated if you are infected. That is the best way to address the epidemic of viral hepatitis in Nigeria.
Are you aware of any government initiative on viral hepatitis in Nigeria?
Of course, the government is working on viral hepatitis. We have the National AIDS and STI Control Program, what we call NASCAP. We also have, technical working groups that are focused on viral hepatitis. As I speak to you, by Monday, we are going to be having a ministerial briefing on viral hepatitis. And the NASCAP is actually anchoring that meeting. What we're saying is, yes, there are some efforts. The government is also working with some partners to see how we can have access to hepatitis commodities, to have access to testing, but we're saying that it is not enough. As I speak to you now, the National Health Insurance Scheme does not cover most of the hepatitis services. It doesn't cover, and that leaves the patient to pay out of pocket. And given the condition of the country now, patients, hepatitis patients may not be able to pay. And let me put it straight here. Hepatitis affects the poor disproportionately. Among the people that are living with hepatitis in Nigeria, you will notice that most of them are people in the lower echelon when it comes to socioeconomic class. And these people are not able to procure this commodity. They are not even able to access diagnosis. One of the tests for viral hepatitis, for example, the viral hepatitis DNA count, is about 30,000 naira. How many low-income earners in Nigeria can even afford that? And it is because of that that WHO has brought down the threshold of the testing. The WHO has relaxed the guideline a bit so that more people can be able to have access to diagnosis and also have access to treatment. What we are saying that the government can do is let the government come bring private sector leaders together, pharmaceutical companies, and say, look, see how you can bring in this hepatitis B commodities for a more affordable rate, so that patients can access it at a very, very affordable rate. Or better still, incorporate it into the National Health Insurance Scheme so that low-income earning patients can access these commodities. That is the strategy we want the government to adopt, in addition to what the government has done so far. We believe that the goodwill of the government of Nigeria can help attract investors, donor agencies to support hepatitis elimination program in Nigeria. And that's what we're asking the government to do.
What progress would you say have been made in integrating the whole idea of viral hepatitis screening and treatment into the primary healthcare system in the country?
Yeah, so I can tell you categorically that there is what we call the triple elimination program now, with the support of Global Fund. Is actually targeting HIV, hepatitis, and syphilis, such that pregnant women will have access to hepatitis screening during their antenatal visits. That's a very good one, and we are hoping that we can, optimize that to ensure that we create that access to prevention of mother-to-child transmission of hepatitis B. Again, we are aware that there is some sort of integration for hepatitis program into primary healthcare, which we believe that will also create an inroad, for more service to be accessed by patients. This is what has been done so far. There's that level of integration of even HIV and hepatitis services. But what we are saying is that there is need to do more, because as I speak to you today, hepatitis kills more people than HIV. Hepatitis is 100 times more infectious than HIV. So if HIV is having the support that it's getting from international donors, I think Nigeria as a government, given the fact that we are an epicenter, we should be able to take up hepatitis and say, this one is ours. Let us see what we can put in to make sure that we support the elimination of hepatitis B and C. So beyond the integration, the government needs to make tangible commitment, just like the government of Egypt did. The government of Egypt did a massive screening across the country, and today they have been able to eliminate hepatitis C. Nigeria should borrow a lead. After all, we are the giant of Africa. I think we should do something about this.
Okay.
Beyond just the integration of hepatitis and HIV services at the primary healthcare level.
Now, you are the national coordinator of the Civil Society Network on Viral Hepatitis in the country. So what is the role of civil society in combating this disease? What are some of the key achievements of this network?
Well, I want to say that, first of all, the role of the civil society is to actually advocate and guide, support the government. We are not working against the government. All we are doing is just to advocate and tell the government it is necessary for investments to be done towards viral hepatitis elimination. It is also our duty to work with the patient organization. The Civil Society Network on Hepatitis is an umbrella organization made up of all the civil societies and NGOs that are working on viral hepatitis. So these NGOs, their work is to go into the community, engage community leaders, and ensure they create awareness among patients, among individuals around hepatitis. It is our duty to defend the patient, to tell the government, look, we have patients that are living with viral hepatitis. They need to be kept on treatment. They need to be able to access diagnosis. They need to be able to access prevention. Please try and see how you can work with international partners and the private sector to make sure that you cater for these people. It is also our duty to also engage private sector, the private sector leaders. It's also our duty to continue to even engage the government and say, look, let us see how we can provide access to patients so that they can have, that opportunity and that, that opportunity to be able to access services. So that is our work. And we are also the ones checkmating what is being done. We look at the budget and we say, government, there's no enough budget for viral hepatitis. We have a lot of budget for HIV and for many other things, malaria, tuberculosis, but nothing is, has been earmarked for viral hepatitis. So it is our job to be the watchdog, to look at how more funding can come to viral hepatitis and also ensure that whatever funding comes in is optimized in the interest of the patient. This is what our roles are. And what we have done so far, I can tell you that we have been able to do a lot of advocacy. Like I told you, this coming week, between Sunday, Monday, Tuesday, and Wednesday, we will be holding awareness campaign across the 36+1 state in Nigeria. We will be engaging community leaders. We'll be engaging other CBOs, community-based organizations. We'll be bringing thought leaders together and say, how can we address the challenge of viral hepatitis? This is the work that we are doing so far. And we want to do more by ensuring that we defend the patient, because we are actually the voice of the 20 million Nigerians that are living with viral hepatitis. This is what we have done, and this is what we are going to do more. And we want the Federal Ministry of Health to give us an opportunity to work with them, to support them. We can show the government how to engage the patient, how to provide services that are targeted at the patient and are targeted at eliminating viral hepatitis in Nigeria. That is what we want to do, and that is exactly our role in this hepatitis space.
What are some of the priorities of, and I know you've spoken a lot about funding and everything. What are some of the priorities of your network, and how exactly can government and the private sector be a part of it?
The priority of our network is, first of all, to ensure that patients are able to have access to diagnosis, affordable diagnosis. So we are looking at government's help working with the private sector to improve access to gene expert machines that can help in advanced diagnosis for viral hepatitis. We are also looking at treatment. There are very effective treatment for hepatitis B, and there is a cure for hepatitis C. So we are appealing to the government that for patients living with hepatitis C, the government should try and provide access to the cure. It's available, it's out there. But it's
so
too
all of that
expensive for
hoopla, what people were saying about hepatitis having no treatment or no cure is not true. Is that what you're saying?
Okay, so there are two types, basically, that is of epidemic level in Nigeria. We have hepatitis B and hepatitis C. Hepatitis B doesn't have a cure, but it has an effective treatment. Hepatitis C has a cure, and the cure is out there.
What's the difference between the two?
The government can help. The difference between the two is that hepatitis B is more transmitted sexually compared to hepatitis C. Hepatitis C is more transmitted through exchange or indiscriminate use of sharp items. That is why hepatitis C is more common among people who have tattoo, people who are victim of needle prick injuries, and people who use drugs, like illicit drug users or injection drug users that are more akin to having hepatitis C. But for hepatitis B, it's more common among mother-to-child transmission. So if a mother is a pregnant woman has hepatitis B, there's a very high chance of passing it to the unborn child. And the same with couples who, if one spouse has hepatitis B, there are chances that he or she may transmit it to the other couple. So there's for hepatitis B, it is more of sexual route and perinatal route, that's from mother to child. But for hepatitis C, it has to really to do with sharp items like needles, syringes, and all those penetrating or piercing tools. That's the difference between them. And now another thing is that hepatitis B is double strand, hepatitis C is single strand, and it has a cure, but it doesn't have a vaccine. So the thing here is that hepatitis B does not have a cure, but it has a vaccine. That means you can protect the next generation from having hepatitis B. If you vaccinate all those who don't have hepatitis B, it gives them lifelong immunity against hepatitis B. Now, for those who have hepatitis C, if you give them a cure, that means you have been able to stop the virus from getting to the next generation. So you can see that it is possible for us to create a world free of hepatitis B and C by vaccinating people from B and curing those with C.
Interesting. So, do you have any events coming up for this, on this particular celebration?
Yeah, we have lots of events. Like I told you, Across the 36 states, we have events holding, and we are working with the state hepatitis focal person at the ministries of health across the 36 states. At the federal level, we are having events coming up at the Federal Ministry of Health, hosted by NASCAP, the agency in charge of HIV, hepatitis, and other STI control programs. On Monday, we are going to be having the ministerial briefing that would happen at the Federal Ministry of Health. On Tuesday, we are going on a road walk from Edo House to the Federal Ministry of Health. And so we invite all Abuja residents to join us in that march. We call it a walk against viral hepatitis. And the theme for that walk is, it is time for action. So we are calling on all Abuja residents to join us. In Lagos, we will be having sensitization meetings and road shows across several locations. We are calling on Lagosians to join. Across the 36 states, we have programs within the state ministries of health, and we are calling on all residents within the states to join us. We are going to be having other programs. So for us, hepatitis is not just about World Hepatitis Day alone. We are going to be having programs all throughout the rest of this year to create awareness, to sensitize people, and we will be going on social media, to let people know when we are having a meeting so that they can key in and get themselves tested, be linked to care, have their treatment, and be able to access vaccination so that they can keep themselves, their families, and their loved ones protected from viral hepatitis.
We do appreciate your time this morning. This has been quite informative for quite a number of people, because many probably didn't even know about hepatitis B or C before this program. And now the information is out there. Thank you so much for your time this morning. Dr. Nsiabasi Ekanem is the National Coordinator for Civil Society Network on Viral Hepatitis, Nigeria. Thank you again for your time, and all the best.
Thank you for having me.
Okay.
Thank you.
Well, next we are talking about guts. No, not having courage. It's gut health. We'll be right back.